Hey everyone, I just wanted to start this video off with a little bit of a disclaimer. This is not a very pleasant story, and if you are sensitive to the suffering of others, I recommend you give this video a skip, just because what this man went through was absolutely horrifying. I wanted to make this video to kind of highlight the side of the story I don't often see mentioned, and kind of quell the misinformation that is often spread about this case. With that being said, I hope you enjoy, and let's begin. On September 30th, 1999 in Japan, tragedy struck at the Tokaimura nuclear facility whilst they were attempting to produce nuclear fuel. A criticality event claimed the lives of two workers, Hisashi Ouchi and Masato Shinohara, while severely irradiating their supervisor, Yutaka Yokokawa. This catastrophic accident was a result of dangerously reckless production practices driven by the relentless pursuit of cost savings and meeting production quotas. The Japanese government had provided strict safety guidelines for such facilities. These guidelines emphasized the careful mixing of uranium hexafluoride and nitric acid in a small container, which would then be slowly introduced into a tall, slender precipitation tank. This procedure was designed to prevent uranium from reaching critical concentrations and triggering a nuclear chain reaction. However, on that fateful day, these safety measures were disregarded. The facility was behind schedule on their order, and management pushed the staff to work at an accelerated pace, even if it meant cutting corners. This led Ouchi and Yokokawa to pour the uranium hexafluoride and nitric acid solution directly into the precipitation tank, using a metal bucket. The resulting mixture was excessively potent, causing a dangerous concentration of uranium to form at the bottom. A blinding blue light then filled the room when the tank was turned on. Ouchi fell from his ladder, and all three men fled the area. Ouchi became violently ill, vomiting and collapsing in the changing room, where he was carried out by co-workers and transported to the National Institute of Radiological Sciences in Chiba. For the initial days, Ouchi's condition seemed relatively stable, but this was caused by the latency period of acute radiation sickness. However, a blood test soon revealed that his lymphocyte count had plummeted to near zero, effectively meaning his immune system was practically non-functional. Recognizing the dire situation, Ouchi was transferred to the University of Tokyo Hospital, where a team of doctors from around the world would start providing specialized care. Upon examining his chromosomes, the doctors were met with a grim sight. Ouchi's chromosomes were so severely damaged that they couldn't even identify which one they were studying. This, effectively, in hindsight, was a death sentence, as Ouchi's body could no longer repair itself. Despite this grim prognosis, the medical team held daily 2-hour meetings to explore potential treatments and began them. They opted for a groundbreaking blood stem cell transfusion, donated by Ouchi's sister, marking the first time this procedure was ever attempted. Hopes were high at this point, with Ouchi appearing relatively healthy, all things considered. In a healthy person, skin constantly regenerates itself through cell division in the epidermis, the skin's outermost layer. However, Ouchi's basal layer cells, responsible for this regeneration, had been destroyed by neutron beams, halting the production of new skin cells. His epidermis, the protective barrier of his skin, began to deteriorate, causing excruciating pain. His breathing also worsened, with X-rays revealing a shadow in Ouchi's right lung. Could it be internal bleeding or pulmonary edema? The medical team faced a challenging problem. While a pleural puncture could remove accumulated moisture in his chest, Ouchi's weakened state and damaged skin posed a significant risk of infection and bleeding. After much deliberation, the decision was made to perform the pleural puncture on October 6, just 7 days after irradiation. The procedure involved forcing air through a mask to expand Ouchi's lungs and increase oxygen levels in his blood. This procedure, while essential, was agonizing for Ouchi, and his cries for pain echoed in the nursing records. "I can't take it anymore. Stop it. I want to go back to Ibaraki. Mother, don't leave me alone." Amidst the suffering, Ouchi uttered desperate words during the treatment, expressing his desire to end it all. It was a shocking moment for those who were caring for him, as they witnessed his anguish and realized the gravity of his suffering. As his condition continued to deteriorate, Ouchi's oxygen intake became insufficient, leading to restless movements and incoherent statements because his brain didn't have enough oxygen. Medication was administered to help him sleep, but it became clear that he needed a tube inserted into his throat to aid his breathing. This decision, however, meant that Ouchi would lose the ability to speak to his family, During the critical period, a new member joined the medical team, Robert Peter Gale, professor of medicine at the University of California's Hematology-Oncology Division. Gale was renowned for his work with victims of the Chernobyl nuclear power plant disaster. Maekawa, one of Ouchi's doctors, personally called Gale and asked for his assistance. On October 8, 9 days after radiation, Gale arrived at the University of Tokyo Hospital, ready to join the efforts. Over the next 17 days, he participated in daily meetings and provided medical care. However, treating a victim exposed to neutron beam radiation was a massive challenge for even someone of Gale's expertise. Various experimental drugs, some not even approved in Japan, were administered to Ouchi in a desperate attempt to improve his condition. Day by day, Ouchi's complaints filled the nursing records. In quotes, "I'm in pain, I am suffering." Even speaking became an arduous task. One poignant moment occurred when Ouchi's wife visited him. He lovingly addressed her by her nickname, expressing his love, which the nursing team found touching, but it carried an underlying sense of urgency. Ouchi did seem to understand the gravity of the situation, and wanted to convey his feelings to his wife even in his weakened state. Perhaps Mr. Ouchi knew what was going to happen to his body. I think that's why he desperately wanted to communicate his feelings to his wife. Even if he felt sluggish, the affection he felt for his wife and family, I think Mr. Ouchi desperately wanted to express his feelings through those few words, said Hanaguchi, one of the nurses deeply touched by Ouchi's words. The next morning, October 10th, 11 days after irradiation, a young medical resident named Kazumasa Yamaguchi returned to work in the intensive care unit after a summer vacation. He was met with a surprising sight. Both private rooms were occupied, and a clean room had been set up, buzzing with activity. It was revealed that Ouchi's breathing had deteriorated, as feared, and immediate action was required. The medical team faced a critical decision. At noon, they initiated the procedure to insert a tube into Ouchi's trachea. At that moment, hope still flickered. The medical team believed that if Ouchi's lung condition improved, they could remove the tube, allowing him to communicate with his family once more. But that day did not arrive. His silent battle had only just begun. Ouchi remained conscious even after the tube was inserted into his throat. His chart from October 13th said, when asked if he was in pain, he responded by shaking or nodding his head. Except for the moments where sedatives would put him to sleep, Ouchi opened his eyes in response to someone calling him and communicated by grasping their hand. Every day, his family came to visit. His wife, his son, parents and younger sister waited in the family waiting room on the first floor of the ward during visiting hours. Maekawa ordered this waiting room be furnished with rouge and grey sofas, a cream-coloured desk, and a space equipped with futons, blankets, and pillows, where the family could rest. Dr. Maekawa had been observing Ouchi's family since his admission to the hospital. To make the long waiting hours as comfortable as possible, he instructed the head nurse Kobayashi's team to replace the sofa and curtains with more cheerful colours. Kobayashi vividly remembered the day she showed Ouchi's wife to the waiting room. The wife smiled and commented on how pleasant the room looked. Kobayashi would regularly enter the room to inform the family of visiting hours, or to check on them during brief moments of respite. She was profoundly moved by the sight of Ouchi's family in that room. Ouchi's wife, son and parents quietly folded paper cranes, devoting themselves to this task. They exchanged few words, but appeared neither down or happy. Each paper crane they crafted was filled with love and care. It seemed that the fewer words they spoke, the more profound their thoughts became. At one point, the family expressed their wish to hang at least one paper crane at Ouchi's bedside. However, there was concern that bacteria or viruses trapped within the folds could not be sterilized, which could pose a threat to Ouchi, due to his destroyed immune system. Because of this, the paper cranes could not be brought into a sterile room. When Kobayashi conveyed this to the family, Ouchi's wife calmly responded, "That's fine, we can keep them here." She meant that they would hang the paper cranes in the waiting room. The family continued to fold paper cranes. The medical team now closely monitored the results of the stem cell transplantation. If it had been successful, Ouchi's white blood cell count should increase. Following the disappearance of lymphocytes, Ouchi's white blood cell count had dwindled to only a fraction of a healthy person's count. His immune system was non-existent at this point. Dr. Maekawa checked the white blood cell test every morning and every evening, almost as if he were offering a prayer. October 16th, day 17 after the irradiation, a change was noticed in the white blood cell count in the blood test results. The morning prior, Ouchi's white blood cell count had stood at 300, but it gradually climbed to 600 by midnight and reached 1000 by 6 AM. Perhaps the stem cell transplant had been successful. To confirm, the medical team conducted an overnight examination of Ouchi's bone marrow. They examined the sex chromosomes from one of the 23 pairs of chromosomes. Sex chromosomes determine an individual's gender, with males possessing both X and Y, and females having 2 X chromosomes. The sex chromosomes extracted from Ouchi's bone marrow cells were treated to die. X chromosomes red and Y chromosomes green. At noon the following day, October 17th, day 18 after irradiation, the test results were delivered to the medical team. Both sex chromosomes from Ouchi's bone marrow cells were dyed red, which meant they were female chromosomes. His sister's cells had successfully integrated into Ouchi's body. Further analysis of a portion of his bone marrow cells confirmed the presence of young white blood, recently generated. These were white blood cells regenerated from his sister's cells. Ouchi's white blood cell count continued to rapidly rise, reaching 6,500 that evening, the same count of a healthy person. The next day it had further recovered to approximately 8,000, to make up as much as 20% of his white blood cell count. Red blood cells and platelets also slowly and gradually improved. They've taken root. Dr. Mikawa breathed a sigh of relief as he confirmed that stem cells from Ouchi's sister had successfully integrated into his body. It seemed like they had cleared the initial hurdle. With such an impressive white blood cell count, there was now more optimism. Yet, Mikawa remained aware of the challenges that lay ahead. He also felt that they had successfully cleared the initial hurdle, a sensation of relief washing over him. The blood stem cell transplant carried out on Ouchi was groundbreaking in the history of radiation treatment. Funnily, the destruction of Ouchi's immune cells due to massive neutron exposure was actually the reason for him to be able to have his sister's cells without rejection. In any case, the transplant was deemed successful at this stage. Nonetheless, Ouchi's overall condition had not improved. He continued to exhibit restless movements, possibly due to intensified pain, and sedatives were frequently administered to ease his discomfort. Despite his inability to respond verbally, the nursing staff made efforts to engage with him in the same way they always had. They shared stories to entertain and relax him while avoiding turning on the radio to prevent him from learning about his fatal radiation exposure. Instead, they played music in his hospital room. Ouchi's family were asked to bring in his favourite CDs, which featured ambient music and sounds of nature to kindle his love for the outdoors. As time passed, the nurses also began to bring their own selection of CDs, which expanded his collection. Naomi Shibata fondly recalled the frequent inclusion of a Celine Dion song in a music selection. Celine Dion, famous for her Titanic film theme song that became a worldwide hit, it was very popular during the time. Among numerous hit songs, the one played the most in Ouchi's room happened to be Shibata's favourite. Although Ouchi couldn't communicate, the nurses hoped that playing his favourite music would provide him with some comfort and solace. On October 25, 26 days after the accident, on the 8th day after the stem cell transplant, Hirai, a member of the medical team, received a report. This report contained detailed test results of Ouchi's bone marrow cells collected on October 16th, and the information it held was mind-blowing. The analysis had conducted on cells taken from Ouchi's hip bone and breastbone, with 30 samples from each area examined. The report confirmed that all 60 cells transplanted from Ouchi's sister. However, there was a remarkable discovery associated with the cells from his breastbone. Some of the transplanted cells now showed signs of radiation damage. Chromosomes were bent and distorted. The medical team were baffled. Hirai, who was a blood specialist, couldn't understand how the cells could be damaged only 1 week after they were transplanted. The team quickly worked on an answer as to what could have caused it. One theory was that the neutron beams Ouchi absorbed literally irradiated certain molecules in his blood in a process called radioactivation, leading to any new cells implanted into him to also become irradiated. Though, and this is what makes sense to me, it didn't make sense according to the others in the team. The half-life of the molecules capable of becoming radioactivated from the neutron beams and emit radiation of their own was only 14 hours, and everything else would be excreted in sweat and urine. It just wasn't possible for radioactivation to be the cause. The answer the team decided on is a phenomenon called the bystander effect, an effect only caused by neutron beam exposure. This phenomenon was first observed in the early 1990s in lab-grown cells. It revealed a weird fact. Cells exposed to neutron beams emitted free radicals, which then damaged neighbouring cells that hadn't even been directly irradiated. free radicals poses an exceptionally high level of reactivity compared to ordinary oxygen. Their random actions inside the body cause harmful side effects, and they are believed to be one of the contributing factors to the development of cancer and the aging process. Critics argued in Ouchi's case, neutron beam radiation had caused the cells to emit free radicals, resulting in the chromosomes generated from his sister's stem cells to become destroyed. Regardless of the specifics, there was no doubt that radiation caused the damage. Hirai couldn't help but feel the terrifying capabilities of radiation. Because Ouchi was incapable of consuming food through his mouth, he had to be fed through a tube connected to the base of his neck, leading to a vein near his heart. Makoto Okamoto received instructions from Professor Masato Omata to conduct an endoscopy on Ouchi. Okamoto was well known for his moustache and glasses look, and also was well regarded in the University of Tokyo for his skill in endoscopy. Mikawa had emphasized to him, in order to facilitate Mr. Ouchi's recovery, it is crucial for him to absorb nutrients not just intravenously, but also through his intestines. If intestinal absorption is possible, there is a hope for his recovery. On October 15th, day 16 after the accident, Okamoto went into Ouchi's room to perform the endoscopy. By this point, most of Ouchi's skin had already sloughed off. Okamoto was very careful during the endoscopy and made sure to sterilize every part that would enter Ouchi's body. The endoscopy was a huge risk. If he accidentally pierced the intestines, it would require an immediate abdominal incision, followed by surgery. But considering Ouchi's condition, an operation would have definitely proven fatal. Okamoto grappled with the intense nerves and fear. As Okamoto inserted the endoscope, the intestines were so taut that even a seasoned professional like Okamoto found it difficult to navigate them safely. The intestinal mucus layer is also susceptible to radiation-induced damage. Stem cells located in the inner mucus layer divide, then aging stem cells from the outer mucus layer naturally shed, replaced by fresh cells. When stem cell chromosomes are damaged by high doses of radiation, they lose their ability to regenerate. Gastrointestinal problems then usually manifest within 2 weeks of irradiation. Contrary to Okamoto's expectations though, Ouchi's intestinal mucus layer was pretty much intact, though some damage was visible. The villi in the small intestines had lost some of their folds, resulting in a slightly rough surface. However, the intestinal mucus layer itself had not vanished, which was good news all things considered. Okamoto documented in that day's medical chart, "The mucus layer appears normal to the naked eye." Upon hearing this encouraging news, Mikawa decided to attempt nutrient absorption through the intestines. At 9 PM the following day, October 16th, food was introduced through a tube connected to Ouchi's nose that led down to his stomach. Approximately 100 grams of food entered Ouchi's intestines. Then, at 1 PM on October 17th, all the 100 grams of food was expelled, along with all the mucous linings of his intestines as stool. Mikawa sadly concluded that Ouchi's intestines were dead and unusable. October 19th, 20 days after the accident, Ouchi was put in a special bed that would rock him side to side to stop him from developing bed sores and to help with circulation. Ouchi received sedatives regularly and spent most of his time asleep. The artificial respiration apparatus forced him to lie on his back, rendering him unable to move. Thick pads were added to the bed to keep his head, arms, and torso and legs still, and also to stop him from, falling off the bed. Nurse Mika Hosokawa wrote down the family's reaction upon seeing him in this bed. Wife and sister visit and state, "Oh honey, they've turned you into a robot." During this period, the term GVHD frequently appeared in Ouchi's medical records. Following the successful stem cell transplant, the medical team constantly checked for signs of GVHD, which stands for graft versus host disease. It is a potential side effect of stem cell transplants where white blood cells generated from the transplanted cells attack the host body, which is different to normal organ transplants where the host white blood cells would attack the transplanted organ. Severe symptoms are caused by it, which usually result in death. 27 days after the accident, a sudden and intense bout of diarrhea took over Ouchi, a situation that Mikawa had dreaded. Diarrhea had first emerged immediately after the accident, but later abated, just when the medical team had started to feel relieved. But it was green and watery. indicating more of the mucus lining was being shed. 2 potential causes were considered: GVHD or radiation damage. Both shared pretty much identical symptoms, making it hard to differentiate between them. The medical chart for the next day stated, red spots and jaundice, typical GVHD indicators, were not observed. However, green watery diarrhea was present in the early morning. It's currently difficult to determine whether this is a result of GVHD or radiation damage to the intestinal mucus layer. Okamoto was then quickly summoned. He performed endoscopy and discovered all of the mucus had shed off, exposing the red muscle layer below this, meant neither digestion nor absorption was possible. Even simple water entering his body was just sent straight through. This is the point where the medical team realized it's basically impossible for him to survive. On the afternoon of October 28, radiation emergencies medicine specialists from the United States, France, Russia, and Germany arrived at the hospital at the invitation of the Institute of Radiological Sciences. The longest survival case of a criticality event victims had been 9 days. Around this time, a significant amount of myoglobin, a protein known as muscle hemoglobin because of its role in storing oxygen in muscles, began to appear in Ouchi's blood. When muscle tissue is damaged, myoglobin is released into the bloodstream, processed by kidneys, and eventually leaves in urine. During earthquakes, survivors can die several days after rescue due to a phenomenon called crush syndrome. This occurs when muscles are severely damaged and release a huge amount of myoglobin into the bloodstream, eventually obstructing the kidney's filtration process, and if not treated very quickly with dialysis, it causes kidney failure, leading to death. In a healthy individual, myoglobin levels in the bloodstream typically remain around 60 ng per milliliter of blood. However, Ouchi's myoglobin levels had gone to over 1,800 ng, due to the necrosis of muscle tissue in his right arm, which then led to kidneys beginning to fail, which forced Ouchi's immunosuppressant medications to be lowered so they were gentler on his kidneys, and the medical team continued to monitor his condition. When he heard of Ouchi's kidneys beginning to fail, the Russian medical specialist wanted to amputate the right arm. However, the medical team did not because of the concerns about the wound being unable to heal, and Ouchi simply bleeding to death. Then, the volume of diarrhea continued to escalate daily, surpassing 3 liters a day. The team of medical specialists then issued the following report. Historically, comparable cases of radiation exposure have resulted in fatal outcomes within 1 to 2 weeks. Despite the thorough intensive care, peripheral stem cell transplant from his HLA-compatible sister, Ouchi remains alive 29 days post-irradiation. The University of Tokyo hospital staff faces the unprecedented challenge of treating a condition without medical precedent, and the guidance we can provide is limited. Upon his arrival to the hospital, Ouchi's right hand had started swelling, and his redness looked more like a sunburn. 2 weeks after irradiation, blisters began forming on the surface of his hand because it received the most radiation. The human epidermis typically gets replaced in about 2 weeks. Due to the complete destruction of Ouchi's chromosomes by the radiation, his skin cells were unable to regenerate, meaning when his skin fell off, that's it. It's just gone. In a photo of his right hand taken about a month after radiation, the skin had almost completely disappeared. The surface of his hand was raw and had turned dark red, like it was horribly burnt. His entire torso became blistered, and when the skin fell off, there was a dotted hemorrhage where the skin had fallen off, and bodily fluids oozed out from it. Ouchi's entire body was covered in dressing and gauze. His wife and sister sadly said, "There's nowhere we can touch him now." Changing Ouchi's dressings became an important daily task for the team. It was a difficult task requiring 10 people. Sterilized masks, caps and gloves were put on before entering the room. Dressings covering Ouchi's entire body were cut into shape, and then gauze already on him was removed. Warm antiseptic solution was sprayed on his body. At the same time, antibiotic ointment was rubbed into the special medical gauze for smooth surface. Careful attention was required to apply the gauze on his body without making any wrinkles. Ouchi's skin had become too fragile for normal gauze because it irritated his skin too much. His fingers were individually wrapped to prevent them from sticking together. Dressings and gauze removed in one dressing change were heaped onto a wagon. Although it was a simple procedure, one dressing change took between 2 and 3 hours because of the caution required to prevent infection. When they removed the gauze, they had to heat the room to 30 Celsius to stop Ouchi's body temperature dropping too low, because without skin, it was impossible for Ouchi to regulate his own body temperature. Professor Mikawa actively participated in these dressing changes. While applying ointment, he engaged in conversation with Ouchi, offering words of encouragement like "is it hurting?" or "hang in there, we're almost done." In addition to insisting with the dressing changes, Mikawa even helped with changing the sheets. The gauze and dressings that had enveloped Ouchi's body became soaked with fluids absorbed from his body. Measuring the weight of these materials became a daily task for the nurses, as it provided insight into the amount of bodily fluids he had lost during the day. Ouchi's body expelled a staggering 1 liter of fluid per day. For nurse Naomi Shibata, witnessing Ouchi during each dressing change was a painful experience. The entire front of his body bore the appearance of a severe burn victim, and with each dressing change more skin peeled away. Despite the numerous sedatives that induced sleep, she couldn't help but imagine the agony he must be enduring. Ouchi's eyelids remained unable to close fully, necessitating application of yellow ointment to them, preventing them from drying out. On occasion, his eyes bled, prompting Mika Hosokawa to imagine that Ouchi's suffering was so immense that he was shedding tears of blood. Even his nails began to detach. The skin on Ouchi's backside remained unharmed, while the skin on his front, directly exposed to radiation, had nearly entirely fallen off. In late October, roughly 3 weeks after the accident, the medical team, during one of its daily 2-hour meetings, decided to undertake a cultured skin graft for Ouchi. Cultured skin, typically employed to treat severe burns, is created by collecting human skin cells and cultivating them in test tubes. It can be produced from the patient's own skin cells or donor skin cells. Grafting skin developed from the patient's own skin cells that carries no risk of rejection, ensuring successful healing. However, in Ouchi's case, his skin cells had taken serious chromosomal damage, making cultivation of his own skin impossible. So because of this, the medical team opted to employ skin cells donated by his sister, who had previously donated stem cells. The risk of rejection was minimal, as the white blood cells had similar shapes. The successful acceptance of the stem cells was used as evidence. A 2 by 4 cm section of skin was extracted from Ouchi's sister's thigh and sent to Ehime University, where the cultivation process took place. It would take anywhere from 2 to 4 weeks to cultivate enough skin. In early November, dermatologist Toshihiko Hawashi, during an examination of Ouchi's side, noticed small white patches at the border between the healthy skin and the skin that had fallen off. Initially, he suspected a mold infection, but under microscopic examination of the tissue sample, he identified it was regenerating skin. Hawashi was relieved that it was not mold and at the same time prayed for the continued expansion of the new skin. In response to Hawashi's prayers, the regenerating skin gradually spread, albeit failing to regenerate at the front of Ouchi's body where the skin loss had occurred. Fluid seepage from Ouchi's skin progressively increased and surpassed 2 liters per day by mid-November. Finding a solution to prevent fluid loss became the most important point of Ouchi's treatment. The prospect of the emergency skin graft was discussed. If successful, even skin culture from other individuals could serve as temporary gauze replacements, preventing fluid loss until the grafted skin also fell off. Additionally, it could help lower the risk of infection, Mikawa reasoned. Cultured skin grafts possessed a growth factor effect that promoted skin regeneration. If this approach proved successful, there was hope for Ouchi's cells to regenerate in the meantime. Mikawa sought cooperation from institutions experienced in cultivating skin. He asked 5 institutions to contribute as much cryopreserved cultured skin as possible. Cultured skin was promptly supplied from each university, and on November 8th, day 50 after the accident, cultured skin grafts were conducted on Ouchi's right abdomen and right leg. In conventional skin grafts for burn patients, the damaged skin is removed using a scalpel to induce bleeding. This is because it helps the cultured skin stick faster, but in Ouchi's case, using a scalpel could result in unstoppable bleeding. So instead, the cultured skin was grafted by gently rubbing the skin surface with gauze to expose a bleeding layer onto which the cultured skin was applied. Skin grafting occurred every other day. In December, the culture skin donated by his sister finally arrived. Unfortunately, due to the huge amounts of bodily fluid oozing from Ouchi's body, the grafted skin loosened after 3 to 4 days and failed to heal properly. While the growth factor appeared to encourage skin growth near the border with healthy skin, it was ineffective on the front of the body. The diarrhea showed no signs of stopping. Meikawa prayed daily for no blood in the diarrhea. Ouchi had essentially lost the ability to clot any cuts, meaning he was vulnerable to massive bleeding if the intestinal mucus layer got completely detached. In the past, lots of patients exposed to huge amounts of radiation ended up dying due to massive intestinal bleeding. Meikawa, with the approval from Ouchi's family, tested every treatment method he found in medical literature that seemed effective, even if it had a weak scientific basis, but Ouchi's condition did not improve at all. On November 18, day 50 since the accident and 3 weeks since the diarrhea had begun, blood was noticed within the stool. Okamoto was called in immediately. Okamoto carried out what would be the 5th endoscopy and inserted his fibroscope into Ouchi's large intestine. Through the curved perspective of the fibroscope, he found that the mucus layer mostly disappeared, with its surface appearing red and inflamed. Normally, intestines are rough in textures. Ouchi's intestinal surface was now smooth. Blood was seeping from the areas where the mucus layer had detached completely, and the volume of bloody stool discharged per day reached 800 milliliters. Looking at the monitor, Okamoto noticed round spots of white tissue in an area between the small and large intestine. But what could that be? Okamoto thought about the identity of these dots while playing the tape over and over. Analyzing a tissue sample would immediately give the answer, but increased bleeding from intestinal damage would put Ouchi's life at risk. After consulting with other medical specialists and thoroughly researching medical literature, Okamoto decided the round shapes were newly formed mucous membranes. Since the confirmation of the mucus layer's disappearance 3 weeks ago, some mucous membrane, expected to have completely disappeared, had begun regenerating. Words like revival and vitality entered Okamoto's mind. It didn't mean much in the grand scheme of things, but witnessing Ouchi's body adapting and trying to overcome gave Okamoto newly found hope. Members of the medical team were also desperate to see such signs. However, on the following day, October 19th, bleeding also started in the stomach. The total amount of fluid and blood loss from Ouchi's skin and intestines reached nearly 10 liters per day. The medical team measured the amount of fluid lost every hour, over 6 times a day. They replenished approximately the same amount of fluid. This was particularly important for blood. Although the peripheral stem cell transplant had succeeded, Ouchi's body was still not capable to form red blood cells, several types of white blood cells, or platelets. Erythropoietin, a drug promoting the formation of red blood cells, and thromboprotein, a drug promoting the production of platelet-forming blood cells, continued to be administered. Meanwhile, red blood cells and platelets were transfused daily. A large quantity of platelets was required to stop bleeding as much as possible. Within half a day, more than 10 blue stickers were pasted onto Ouchi's nursing records. These stickers were used on blood packs to indicate information such as blood type. Ouchi's blood type, O, was marked on each sticker. 10 stickers meant that Ouchi had received at least 10 transfusions within half a day. The medical team had no choice but to devotedly continue the transfusions while praying for Ouchi's capacity to produce its own to recover. Day after day, the following was written in Ouchi's chart under consciousness. Level E4 VT M4/GCS. No major changes observed. Grimace in response to great stimulation, but limbs don't move. To explain what this means, you need to first understand the GCS, or the Glasgow Coma Scale. Is an international index created in 1974 by the University of Glasgow to understand consciousness in events such as comas. E stands for eye-opening, V for verbal response, and M for motor response. The 4 attributed to Ouchi's eye-opening was the highest level. In quotes, eyes opened spontaneously. They put T for verbal response, which stands for tube because of his inability to speak due to the tube in his throat, and 4 attributed to his motor response was the highest level. Withdraws limbs when touched. In other words, Ouchi was still completely conscious. He made painful expressions when nurses held up his arms or moved his legs during treatment. Large doses of painkillers and sedative were administered every day. According to his medical chart, a sedative called propofol and a painkiller called fentanyl were constantly administered intravenously. Every hour, 200 milligrams of fentanyl, a synthetic narcotic said to be 100 times more effective than morphine, was administered. This is the equivalent to the amount used during an open skull surgery of the brain. Ketamine was also administered, effective for relieving constant pain. Ketamine is often used to treat burn victims. The medical team administered these drugs in combination. In the seemingly endless tunnel of Ouchi's treatment, the only effective treatment they could provide so far was pain relief. After the blood stem cell transplant had succeeded, endless days of unclear treatment results ensued. Few physicians spoke up during the treatment deliberation meetings held after the morning and afternoon rounds. It was a stalemate. Instead of proactively deliberating treatment methods, discussions focused on how to maintain Ouchi's current condition. Mikawa did not go home during this period. Instead, he napped in the hospital hallways or laboratories, in alternation with many other physicians. In addition to the physical fatigue, he was mentally run down. Everyone wondered what the point of continuing the treatment was. As a physician, Mikawa had never witnessed such horrible damage to the skin and body. Every day was full of surprises. The focus of the treatment was to maintain Ouchi's blood pressure despite the large amount of fluids being lost. There was a risk that his heart would be unable to cope with the sudden fluctuation in blood pressure and come to a stop. Junko Nawa had witnessed a stark transformation in Ouchi since his arrival at the hospital. She remembered a time when he spoke normally, but now he had deteriorated completely. Providing care for him as he continued to change shocked her to her core. She couldn't fathom the extent of this deterioration. Thinking, "I didn't know that a human being could undergo such a profound change," in quotes. The front side of Ouchi's body had lost almost all its skin, and he was bleeding from his mouth and intestines. The medical team was in a desperate struggle to replenish his fluid loss. Nawa couldn't help but question the ethics of this treatment. She thought, in quotes, "I don't believe Mr. Ouchi wants to endure this existence. It might be different if there was hope for recovery, but it's increasingly unlikely that he'll survive. Keeping him in this state for so long must be excruciating for him." Nawa voiced her doubts to Mikawa, asking, "How much longer will you continue this treatment?" in quotes. Mikawa responded with a faint smile but remained silent. Even Dr. Mikawa seemed uncertain about the path forward. During this period, Maki Hanaguchi often found herself plagued by nightmares. In these nightmares, she would see Ouchi lying in the bed before her. Then a catastrophic accident similar to the one at Tokaimura would unfold within the hospital. Her skin would rapidly fall off, mirroring Ouchi's condition, and the pain would become unbearable. To make matters worse, more patients in the same dire condition as Ouchi would arrive at the hospital, and she would find herself caring for them while suffering from the same symptoms. These dreams were haunting and left her deeply disturbed. Observing Ouchi's deteriorating skin, Hanaguchi was convinced that he was enduring intense pain around the clock. Despite the sedatives and painkillers administered, she couldn't shake the fear that his suffering persisted. Hanaguchi had lost faith that Ouchi's condition would ever improve. She couldn't help but wonder if they were subjecting Ouchi to painful treatments, all while being aware that there was no hope for improvement. The thought weighed heavily on her conscience. In quotes, "After his condition deteriorated, you'd never guess looking at him that it was Mr. Ouchi," Hanaguchi said. Whenever Hanaguchi cared for Ouchi, she would cling to the memory of the words he had spoken to his wife. "I love you." But looking at Ouchi now, so far removed from that moment, she struggled to see him as the same person. Day 59 marked the final nail in the coffin for Ouchi's suffering. At 7:01 AM, Ouchi had a heart attack. Over the span of an hour, his heart stopped and was started again 3 times. During this time, his heart wasn't beating for 49 minutes. When his heart failed, doctors had to ignore the standard procedure of sanitizing themselves because there wasn't time to waste. By the end of the day, his heart was beating again, but Mikawa was clearly very disheartened. The heart stopping for this amount of time was sure to cause serious damage. When Ouchi's heart started beating again, Hanaguchi thought, "Thank God, Mr. Ouchi has come back." She was amazed that his heart had revived under such conditions and had wondered if it was a result of his sheer will. In quotes, "Mr. Ouchi is persevering, he wanted to come back." Hanaguchi was embarrassed at the assumptions she had made about Ouchi's feelings. She had almost given up on him as a result. She thought to herself, "I have to try as hard as Mr. Ouchi." but the family still believed in Ouchi's vitality. The following was their response to Maekawa's explanation. Even if his heart stopped and started beating again, he'll get better. Their hope, their refusal to give up, came across painfully. To Maekawa, it seemed like the tables were turned. The family members were giving the physicians their support. Although his voice had been taken away, Ouchi had been able to communicate his feelings with his facial expressions or his body. But after the cardiac arrest, he no longer responded to his family. His life was now sustained solely by machines and medication. Words spoken by his family remain in the nursing records. The mother spoke to her son, "Hisashi, hang in there." The father whispered into his son's ear, "Hang in there until the end." Unfortunately, past this point, Ouchi did not regain consciousness. After assessing Ouchi's state and realizing that the battle was coming to an end and it was basically impossible for him to ever wake up again, never mind recover, Maekawa took Ouchi's family into his office and laid out his entire treatment from day one up to this point in great detail. Every decision, step and event in Ouchi's treatment to try and explain the reasons why he thought it would be best that the next time Ouchi's heart stops, they didn't resuscitate him. After an hour of explaining everything, the family sat down and calmly replied with, "We understand." By this point, the family had folded 10,000 cranes to try and speed up his healing, and Ouchi's medical chart now stated, "Do not resuscitate." Then, tragically, on day 83, at 11:21 PM, December 21st, 1999, Hisashi Ouchi passed away. He was 35 years old. His 83-day-long battle was over. He was at peace, finally. His suffering was over. Shibata gave Ouchi his last bed bath, and she told him, "You did everything you could. You could finally rest now. That was a lot of pain and suffering, but you don't have to worry about it anymore. You must be relieved. You did your best," were the only words that came to her mind. Once she removed the intravenous needle and looked over him with all the medical equipment removed, his death finally set in and she couldn't hold back her tears anymore. During the autopsy, it was discovered that every single one of his organs were either damaged irreparably or completely destroyed, except one, his heart. After all this time, after all his skin died and fell off, after his intestines stopped working, his lungs and stomach failed, his heart was undamaged. The coroner responsible for Ouchi's autopsy could not explain how it was possible, and decided it must just be due to Ouchi's immense strength and determination to live. It is undeniable that the story of Hisashi Ouchi's 83-long stint through hell is tragic and heartbreaking. But in my opinion, what else is tragic is the way people portray the family and the doctors. The internet is filled with misinformation and lies. It is often stated that the medical team only kept him alive to use him as a lab rat, or to run experiments on him. But the way they treated him and his family clearly contradict this. They bonded with him, learned of his favourite music and decided to play it to him, and of his love for the outdoors, and played him sounds of nature. They accommodated for his family by retrofitting the waiting room into a comfortable living area. And by the end, the entire medical team was grieving and heartbroken, almost as if they had lost a friend. You can't possibly care for someone 3 months, fighting to save their life and not bond with them. And the family was just clinging on to the hope that their husband, son or father could possibly live. They held on to their hope the entire time, and when it came to the point that Maekawa informed them that there was no chance for that to happen, they did not protest. They accepted it. People seem to view it too narrowly or two-dimensionally. It is important to understand, technically there was always a chance that he could live, and this had never happened before. They could not possibly know how bad it was going to get. The doctors did the best they could, and once they realized there was no more hope, they stopped trying to keep him alive and let him die in peace. In the end, the only thing that really sticks into my mind is how tragic the whole story is, how strong his family is, and that I hope, wherever Ouchi is, that he is now at peace. Thank you for watching. I know this video was a bit disturbing and heart-wrenching, but I really wanted to do my best to lay out the whole story and do my bit to counter the misinformation that is floating around on the internet. If you enjoyed this video, I hope to see you in the next, and until then, I hope you have a good day. Goodbye.